there is a regeneration possibility.
When you said pretty successful in Parkinson's patients, how would you define that in terms of percentage and people showing improvement, and what degree of improvement, or holding the line, or what?
Holding the line is the bottom line, what we expect. In very severe cases, if the decline is not like linear and not like an E function, like goes like that, it's a small success. But the least what we expect is to have a steady state. That's what we see most often. And then over the course of time, repair, which means not only the mimics but the movement, the speech, and also the cognitive functions are stepping up. Because if you are doing every day the same thing and you don't have to be creative, you can lose a lot of brain function, cognitive functions without, and nobody realizes it in your surroundings, not even you by yourself. It's if you have the cognitive function in persons who have to be creative, you can faster realize how they step up. And the people, because the people, you are yourself 24 hours a day, so you realize that in the first place, and that's the feedback from the patient. So it's the movement, it's the mimics, it's the brain function as a whole. That's and the improvement of that. And it goes from about that much to really a lot. And that's what we, the measure, if you ask of the measure, we cannot really measure it overall, because we're treating individuals. And what we don't know is the genetics before. What possibility do they have? How many repair genes they are active? How many are shut down? How many can be reactivated? It's actually a course of time, step by step by step. And I always say the small steps are the sure steps. If patients have, after 4 weeks, sensational improvement, I'm sure that they will go down after a while again. And the people who are stepping up slowly, that's the real repair. And then of course the neuropaths, they can also show. We have in Greek patients, for example, we have quite a few neuropaths, PET scans over a few years in Parkinson's, in stroke patients, where we could show even in areas where there was no activity at all. Now after a year, after 2 years, after 3 years, we have now almost normal activity.
Now, are you talking about being on the regimen he's on now, or
No.
are you? Can you shut that off? So please.